Faradic current has three practicals. One, stimulation of group muscles and individual muscles. Two, Faradism under pressure. That means you stimulate the muscle under the pressure. You put a crepe bandage. Three, Faradic foot bath. That means inside the water you stimulate the muscles of the foot. So these are the three practicals for Faradic current. Today we are going to see the Faradic current stimulation for group muscles and individual muscles. So as I said, there are motor points. Motor points means where you can stimulate the muscle on the body. I will show you some examples where to stimulate the muscles. Some of them should be done with a pen electrode. Some of them will be done with the carbon rubber electrode. So we will see whatever muscles can be done with the carbon rubber electrode. Rest of the muscles you should remember which you need to do with the pen electrode. Okay? So I need one model. You have to follow your practical performance, like greeting the patient, communicating with the patients. Okay? Like, hello, I am Dr. Jayashankar. What is your name? Okay. So what is your problem? Shoulder. Okay. Some problem with the hand and shoulder. So what I am going to do? I am going to do a particular patient come with a particular problem. So I will stimulate the muscle, biceps muscle. I want to make it more stronger by stimulating with electrical current. Okay. So I will tell I am going to keep some current for your biceps. If you feel any problem while stimulation, please let me know. Let me assemble my gadgets. Like that I will tell the patient. I will make the patient sit. Then I will collect all the apparatus what I need. I may need water, I may need electrodes, I may need the covers, I may need towels, I may need straps, whatever is needed for my treatment, I will collect all the equipments. After collection, then we will rule out the contraindications. First see the skin. Okay, you can feel here. Can you feel the touch?
No.
You cannot feel the touch?
Yes.
You can feel the touch?
Yes.
Okay, so why? Because there is any problem with the sensation. When you keep the electrode, patient don't feel anything and it will cause damage to that area. So the first primary important thing is, can you feel? Test the sensation. Can you feel? And feeling here and feeling here. Same or it is different?
Same.
Okay, if it is same, then it is good. No problem. So that is the minimum thing what you have to do. Then rule out your contraindications, indications, collect your apparatus, do the self-testing. Then you go with the stimulation of the patient muscles. You have to follow the first practical what I told you, the practical performance steps. Now to decrease the time, I can do all those things, but it will take time for you. To decrease all those things, we directly jump into the stimulation. I will upload these motor points in your practical blackboard or theory blackboard, wherever, the practical criteria. There are many motor points. If you go and see the motor points of the arm, okay, there is posterior aspect and there is anterior aspect. Two aspects are there. So in the anterior aspect, what all muscles you can stimulate? What all muscles are superficial? If you see here, this is biceps. This area is biceps. This area is for brachialis. This area is for brachioradialis. Okay? And this area is for deltoid anterior fibers, deltoid middle fibers, deltoid posterior fibers. Posteriorly, this area is for triceps. Like that, you have the areas where you need to stimulate the muscle, which is the good area for stimulating the muscle. So you need to know, for example, if I ask, show me some muscle stimulation points on arm, anterior surface or posterior surface, you should be able to show by seeing this picture. Okay, in this picture, it is clearly given where is the muscle motor point for this muscle. Okay, now I will show you some examples. For example, I want to stimulate biceps. So, as I told you, we will keep cathode on the muscle where we are going to stimulate. So, we will keep cathode on the muscle. Before that, we need to decrease the resistance of the skin. So, take some water, apply it nicely on the biceps and other electrode, where you are going to keep? Other electrode I am going to keep on the cervical spine, because the nerve which is supplying the biceps will be coming from the cervical nerve roots. It is the musculocutaneous nerve. This musculocutaneous nerve is going to come from C5, this particular area, to the muscle. So I am going to stimulate around C5 area with the anode. I will tie the C5 area electrode to the cervical spine. What is the strap? Just make this here. Okay. So I will keep the inactive electrode or indefinite electrode onto the cervical spine. This is the anode. Okay? Onto the cervical spine. Is it too tight? You can keep, Shabab, you can keep either cervical spine or any place proximal to the nerve. Shabab, proximal to the particular muscle. For example, there is something called as Erb's point, where all the nerves will be superficial. For example, here, shoulder. This area is a good point when you stimulate the arm for keeping the inactive electrode. For example, if you want to stimulate the forearm, okay, if you are stimulating the anterior aspect, you have to keep it on the lateral epicondyle, where the nerve which will stimulate the forearm muscles will be here. But at the same thing, when you are stimulating the posterior muscles, you should keep it onto the lateral epicondyle, the inactive electrode. Anode, inactive electrode should be onto the lateral epicondyle for posterior aspect of the forearm. You can keep here, you can keep here, you can keep here, no problem. But the more near to the cathode, more stronger will be the muscle contraction. Okay, inactive electrode usually kept on the proximal nerve which is going to supply that area. For example, you are stimulating the hand. When you are stimulating the hand, you can keep it on the same areas. Forearms, you can keep it onto the Erb's point, or you can keep it onto the cervical spine. No problem. So this is a unipolar technique. You are going to keep main electrode on the muscle, inactive electrode somewhere else. What is this technique? Unipolar technique, where the main muscle, what you are going to stimulate, so when I want to stimulate the biceps,
This is unipolar.
unipolar, yes. Main electrode is on the biceps, that is cathode on the biceps. The inactive electrode is somewhere else. Okay, mainly the nerve which is supplying that area should be stimulated. Come to put a supine position, but he is okay, no problem. Sitting,
No problem. Sleep.
no problem. Sleeping. So go to Faradic stimulation. There is rectangular alternating, triangular alternating. So I choose rectangular alternating. Any of the types you can choose. Rectangular, when it in the system, if it shows only one side the curve, that means it is a direct current. The system, if it shows the graph up and down, then it is a alternating current. So you can choose any type. What is the difference? Alternating current is easy to take in by the body. Direct current is little harsh on the body, little hard on the body. So I am taking a rectangular current. So I have kept it on channel 1. So I select channel 1. The treatment time 30 minutes. Okay. Then go to the intensity, pulse duration, polarity negative, because I want to cathode as a major electrode. Pulse duration 1 second. Pulse interval 20 milliseconds. Good. Surge program. Okay. And I will start with the intensity. Is it more? You're getting the current? Are you getting the current? Yes or no?
Yes.
More? There. See, it will come like one shock here,
No.
second there. One here, one there. Like that it will come.
واحدة هنا واحدة هنا.
No, no. You have to go.
Everything here? Here no. I'll increase little, then you will feel here also.
بزيد.
Feeling?
Yes.
Both places?
Yes.
Sahadina Wahidana? Any problem?
No.
Can I increase?
يقدر يزيد.
خلاص خلاص.
Color. Zyada? More? Can I decrease? Decrease. Okay?
Okay.
He is very strong. Doctor, increase. Doctor.
Yeah. Can you feel the muscle contraction?
Yes, yes.
Can I increase more?
No.
Nothing will happen. Nothing will happen.
Increase?
Increase, just only increase in current, that's it. Nothing will happen. Anavasam.
خلاص خلاص خلاص.
Color. Relax, relax. Okay, if you see, there is like pulse, movement. Okay, yeah, come. This is example for muscle stimulation of anterior compartment of the leg. Anterior compartment, there are many muscles. Tibialis anterior, there is a extensor digitorum, okay? Extensor digitorum longus, extensor digitorum brevis, okay? There are extensor hallucis, okay? There are many muscles. What we are going to do is, we are going to show you the stimulation of all these muscles together, okay? So, we keep
That's me to remove the
here.
hair.
If you are giving for prolonged stimulation, like 4 weeks, 8 weeks you are giving, then better to remove. Going for only one stimulation, no need. Okay, just for testing, no need. But for prolonged stimulation, you should remove. Then, inactive electrode is anode. This is a unipolar technique, where the active electrode should be on the muscle. So before applying, I have to decrease the skin resistance. So apply sufficient amount of water and clean the area. Okay? Once it is okay, the area is okay, tie the active electrode, see, 2, 1, 2 onto the muscle.
ما عاد تقدر يلفها من تحت ما شاء الله
اترك مسافه بينك وبين زميلك.
Okay? The inactive electrode. Usually, this compartment of the leg is supplied by the nerve, the common peroneal nerve, which is coming very superficial here, around the fibula. Around the fibular head, the common peroneal nerve will come. So that is very superficial. That nerve supplies the anterior compartment of the leg. So the inactive electrode should be on that particular nerve. So again, take the water, decrease the skin resistance on that particular area, and apply the electrode. Apply the electrode. This is not muscle, this is the nerve. Yeah, this is the nerve. Inactive electrode on the nerve, which is supplying this compartment. The active electrode is on the muscle, which we are going to stimulate. Now you have to relax. This is also relaxed.
why this unipolar? Why?
Unipolar, in bipolar, 2 electrodes on the muscle.
Same muscle, doctor.
Same muscle. Two electrodes on the same muscle. In unipolar, only one electrode on the muscle. Inactive electrode is somewhere else.
But the area it's small when compared to the electrode.
So the area is big actually, not small. This is all the muscle.
Yes.
Okay? And I am stimulating only here.
Yes.
If it is individual muscle, then I have to go with the pen electrode.
It's
If it is a group muscle, then I have to go with the big electrode. So now I am doing a group muscle stimulation of anterior compartment of the leg. Almost all muscle, but the main muscle is tibialis anterior. This muscle.
Doctor, bipolar more strong.
Yeah, bipolar is more strong. Go to electrotherapy, muscle stimulation,
Yes.
Faradic current, any type of the currents, no problem. I am selecting rectangular. This is channel 1.
Rectangle.
The shape of the current is rectangular. Treatment time is like 30 minutes. Electrode. We have selected the carbon rubber electrode. Polarity is negative. Then duration 1 second. 20 milliseconds between. Surge mode on. The whole time of the muscle contraction. See, I am increasing up to 20 seconds, 30 seconds, no problem. Okay? 60 seconds means 1 minute. 20 seconds means 1/5 of the minute. Interval is 1 second. Okay, good. Back. Start. And increase the intensity. Now, for example, this in the practical you have to know the name of the nerve, where to keep the inactive electrodes. I will tell you. Yes, Alam, where are you? Coming, just 5 minutes.
Same direction. أهم شيء same direction.
So sometimes when there is less water, the electrode do not contact properly. Okay? For arm, the inactive electrode in cervical spine, neck, or Erb's point. Okay? Erb's point. For forearm, for flexor compartment, inactive electrode on the medial aspect of the arm. Medial epicondyle of the arm. Here. See? Medial epicondyle of the arm. For inactive electrode, for the posterior aspect, is the lateral epicondyle of the arm. Okay? For hand, it is again same. Medial epicondyle of the arm, lateral epicondyle of the arm. For flexor, medial epicondyle. For extensor, lateral epicondyle. That is inactive electrode position for upper limb. For spine, for example, back you are treating. The inactive electrode can be on the cervical spine or of the center of the spine. Okay, the center of the spine. For example, you are stimulating a muscle which is related to thoracic spine, then inactive electrode is on the thoracic spine. For lower limb, for leg, anterior aspect, posterior aspect, inactive electrode is on the lumbar spine. You know where is the lumbar spine? This area. Okay? It should be in the lumbar spine. For leg, anterior compartment on the lateral aspect. Posterior compartment in the posterior popliteal fossa. Here, in the popliteal fossa for the posterior compartment. For the foot, again same. Dorsal aspect on the lateral compartment. For the plantar aspect onto the posterior compartment of the popliteal fossa. Okay? Here. This area for the posterior compartment. Because the tibial nerve will be there. Common peroneal nerve, tibial nerve division will be there.
Here, we're inactive.
Here.
This is inactive.
Inactive. Active is on the muscle.
Yes.
Okay? And what is the mode? Shabab. No, Shabab, silence please. Shabab, very important point. For electrotherapy, there are 4 important things. Mode of the treatment, intensity of the treatment, frequency of the treatment, and duration of the treatment. For Faradic for Faradic current, the mode of the current is usually alternating current, the Faradic current in a surged format. The mode of the current is Faradic current in a surged format, and it should be interrupted. That is the mode of the current. Slowly increase, slowly decrease. Okay? And there is gap between one phase and another phase. There is a stop. There is a stop duration. That is mode. The next one is intensity. How much current, how much should be the maximum intensity? It is depend upon the patient.
Until the patient says.
What is important? For treatment, you should see a visible contraction. That means when you apply the current, you should see some movement. Okay? That is one for intensity. Two, it should be bearable by the patient. Patient should be able to take it. Two things. Okay? One, the intensity depends upon how many milliamperes, 30, 40, 50, depends upon patient. Two, to get a good treatment, you should be able to see the
Current.
movement of the muscle. These are the two things. For that is for intensity. Frequency. How many times you can treat? 3 to 5 times in a week.
3 to 5.
Okay, every day is not needed. Minimum duration is 3 times a week. Maximum is 5 times a week. Okay? Duration. How much time to treat?
Depend on the patient.
Not depend on the patient, it is depend upon you. Okay? Each time when you start treating the muscle, individual muscle, I am talking about individual muscle, 30 contractions. That means 1, 2, 3, 4, 5,
Unipolar.
6. Okay? Like that, 30 contractions minimum. Okay? 3 sets. 3 sets. 3 sets means 30. Stop for 2 minutes, again 30, stop for 2 minutes, again 30. Yeah, gap. Okay?
Good.
This is duration. This is for one muscle. Minimum. How to decide maximum? Shabab, how to decide maximum? How to decide maximum is, for example, he is a sports person. He is a strong person. You give the contractions till you see the decrease in muscle strength. After some day, after some number of contractions, muscle will become fatigued. That means previously the contraction is like this: 1, 2, 3. After 100 contractions, it is like. That means fatigue. So when there is a fatigue, tired, stop. Give for 2-3 minutes rest. Again do 90 to 100 contractions. So the minimum is 30 contractions. Gap, 30 contractions, gap, 30 contractions. 3 sets, each set 30 contraction is minimum. Last one, for one muscle. Okay? If the more number of muscles, more time it will go. So that is about duration. So all these 4 things are clear. Mode, frequency, intensity, duration. Clear?
Clear. Finish. Thank you.